I've been to 45 or 50 states and been to over 30 countries at this point, mainly in Europe and Asia, but my hope is to, add to that list with my wife moving forward. My name is Cherng, and I'm a radiation oncologist at Valley Mount Sinai Comprehensive Cancer Care. So I was always very interested in science, but I really didn't know if I wanted to be a doctor or not. And so when I went into college, I was kind of open-minded. I did a lot of things. I studied law, engineering, nursing, kind of trying to find what would be my passion in life. But ultimately, I kept resonating back to the sciences and really interacting with families and patients. And I did a lot of time actually volunteering at the Children's Hospital, and that's where I first interacted with patients. And I saw how they interacted in working with their families, and I really enjoyed that sort of longitudinal relationship. One of my first questions that I have when a patient steps into my office is, tell me what you know. And sometimes that's nothing. Again, radiation oncology, I'll be honest, I didn't know anything about it, so I don't expect the patient to know too much about it. But sometimes they may have a family member who's had radiation or a family friend, and so they might come into the meeting with some preconceived notions or some understanding. Patients have different needs, and not every patient comes into an encounter specifically needing this or that, and so just listening, you're able to pick and kind of glean what the patient wants out of the relationship as well. My wife and I, we love museums, so anytime we can get a chance, a free weekend, we like to go to museums or perusing a small city and go down the streets and visit local shops. She likes buying a lot of knickknacks and toys and those types of things. We're both big foodies, and so we'll probably go to some restaurant depending how we're feeling. I don't know what cuisine at this point.